Good morning, everyone. This is Dr. Susan Marra and Juju, my 19-week-old French bulldog. She's got a little drool on her. And this is Dr. Marra's Medical Minutes. And today we're going to talk about what is the ideal patient. Well, that differs according to different practitioners, but for me, the ideal patient is someone who has excellent listening skills and who is willing to put in the work. Getting well from tick-borne illness or mold illness is no easy feat. It's very, very challenging. The Alzheimer reactions, the change in meds, all the supplements, the blood work, not feeling well. It's just not a very fun thing to have to go through. But it is necessary to get these infections treated, because if you don't treat them, they will get worse. And the consequences of not treating the infections are pretty severe. So I wanted to just talk about the, Juju's going to sleep, the characteristics of an ideal patient. Somebody who listens really well, someone who takes notes, someone who's organized, someone who pays attention to themselves and listens to the clues that your body is giving you, someone who is compliant. That doesn't mean you have to be neurotic, but generally, show compliance, because if you're not compliant, I'm not going to be able to get you well. I mean, it's already difficult to get people well from these infections, just because they're so pervasive and they're deep, and they wreak a lot of havoc on the body. Another trait is somebody who has a good relationship with me. So, you can call me, but, don't call incessantly. But if you need me, call me. And an accurate relay of your symptoms at every office visit is super important, because that helps guide me to choose the best combination of herbs, antibiotics, vitamins, whatever it is. So that's super important. And someone who's going to be willing to make lifestyle adjustments. For example, you're probably going to have to take wheat, dairy, and sugar out of your diet. And I know it's hard. You don't have to do it all at once, but you should, step by step, try and remove wheat, dairy, and sugar, because those things are very inflammatory and they will make your condition worse. You need to drink 2 liters of water a day. You need to take your supplements and your drugs, and you need to get at least 8 hours of restful sleep a night. If you have psychiatric issues, it'd be a good idea for you to get a counselor or a psychiatrist to help you during the rocky parts of treatment. You're going to have to go through some herxing and some detoxing. So if you have access to a sauna or, a red light or a jacuzzi, that would help you as well. So these are the things that I think would help you as an ideal patient. Nobody's perfect, and I don't expect you to be perfect. I'm not perfect, but I've been going through this treatment for many, many years. And I can tell you, those people and myself who are compliant to the best of their ability are the ones that get well. So that doesn't mean that there's not going to be bumps along the way, and you may have a few relapses, like if you get in a car accident or you have a big life stressor, but we can get you back, and it's not a life sentence. So I hope that this information helps you, and I hope you have a wonderful day.